today we're going to go over the skill for starting an IV. Pretty quick one. We're going to start off by confirming our physician orders. We have an order here to initiate an IV saline lock. We're going to do our K-wipes. We're going to do our true identifier stand check at 6842. I've checked my wristband, and I want to verbalize why I would need a larger gauge IV versus smaller gauge. Smaller gauge is going to be reserved for smaller veins, pediatric patients. Maybe you just needed some IV fluids, nothing too serious. Our larger gauge IVs, thinking 20 or higher, mostly 18s or higher, you're going to look at trauma patients, patients that need blood transfusions, or patients that need certain CT scans will need a larger gauge IV. Now I want to get my flush, I want to get all my air out of it, and then I want to connect it to this white tip, the lower lock here. I'm going to screw this on, and I'm going to prime my tubing here. I want to make sure there is no air in this at all. I will set this to the side here. Here, let's see the verbalized interventions that might help venous access, thinking about warm packs, compresses, ultrasound guidance, many others. How to stabilize a rolling vein? I'm always going to stabilize that by holding the skin tight. As you can see here, I would pull the vein apart from each other. Then I'm going to apply my tourniquet here. This will probably require the most practice of any part of the skill is how to properly tie a tourniquet. I'm going to apply my tourniquet. I'm looking for a vein. It says most distal. Our most distal here would be the back of the hand, but we're not going to require you to do it. Just mentioning that you would normally choose the most distal. I found a vein that I want to do. I'm going to release my tourniquet. I'm going to clean my spot here, and I'm going to allow it to fully dry and reapply my tourniquet. I will get my needle. I want to make sure I have my flush close by, I have my dressing and stuff close by. I want to pull this out. I've already cleaned my site. I'm going to pull the skin tight here, making sure bevel up, which is easy because it's your little white button up. I'm going to insert my needle at a low angle. What I'm doing here is I'm looking for blood that will be in this chamber. Once I see that blood in the chamber, I would advance just a little bit more, and then I'm going to take and advance this only. I'm going to remove my needle here. I can push my button. I've got pressure above here. I'm going to disconnect this, and I'm going to put this on my thing. First thing I want to do is pull back. Do I see blood return? Yes, I do. And now I'm going to flush my IV. I will put on my dressing, and I would tape this other part to the arm. On my dressing, I'm going to put my date, time, and initials. It says gauge, but your gauge is done by the color. They're all the same. After I've flushed it, I will take this flush off. I want to verbalize signs of infiltration and phlebitis. Thinking of infiltration, you're going to have swelling at the site. It's going to be cold, tender, and whenever you have phlebitis, it's going to be red, warm, and inflamed, and you may see red streaks come down the arm. That's how you get a discuss there. Then we're going to dispose of all our items and document. Even the document's not a point on this one, and that would be it.